I laughed and cried at the same time. I was laughing so hard that I was crying, and then I was crying so hard that I was laughing. My husband was just standing there pale with no words. Like words just escaped his body. There was nothing. And then all of a sudden we're like, we're having twins. And then it was like the overwhelming joy that they say you have. And, you know, that whole thing went on. And 20 minutes later, we walked to the car and we just looked at each other and we're having twins.
Twin-twin transfusion syndrome is a condition that develops specifically in monochorionic twins. Universally, monochorionic twins share vascular connections on the surface of the placenta. These connections allow flow of blood between the twins. Most of the time, there is a balance, but on occasion, this becomes skewed, and then essentially one twin has more volume in its circulation than the other. The ideal treatment is called selective laser photocoagulation of the placental vessels. And the idea is to use the laser energy to close them.
If this is 20 years ago, we would have lost them. They made it possible. I had the same nurses, and even when I walked down the halls of special care nursery, when I saw them, they still knew my name. For them to just stop, when I know there's probably 5 women having babies, for them to just stop, ask how we're doing, that made us feel special. That made us feel like they actually cared.
It's a condition that can happen so quickly, but there is definitive treatment for it that can change a condition that has near universal mortality into a positive pregnancy outcome.